Hello, I'm Dr. Richard Minter. I'm a primary care physician here at the McDonough District Hospital.
Hi, my name is Stacy Minette. I'm a population health nurse care coordinator here at McDonough District Hospital.
My name is Keena Ashford, and I am a bachelor's prepared registered nurse.
Advanced care planning involves a decision-making process between the provider, the healthcare professionals, and the individual and their family. And basically, they're trying to make whenever something was to happen to where the person was near end of life, or if you were in an auto accident and you were suddenly became totally incapacitated, whatever your individual wishes are, we as healthcare providers want to follow those wishes as closely as we can possible.
It's important to let your family members know what your decisions are to help the stress involved at the end of life. Family members can feel guilt whether they're making the right decisions that you would want, and also other people maybe have their ideas of what's best for you, and by having it all written down and having the conversations with your families beforehand reduces that stress at the end of life.
There is a small amount of paperwork involved, and our healthcare staff here are able to work with you on that, and there's a couple of forms that we end up signing. Generally, we have the patients go over the information that's been decided upon with their family so that they know what their wishes are, and if they have any suggestions, then they can bring it along the way. One of the issues that we look at for why healthy individuals should do healthcare planning would be something we don't know what may happen. You may be healthy today, but tomorrow you may not be. Being healthy now is the best time to make those decisions, because with that, you're sharp and you're focused and you know what you want to have done. And when you are healthy, is a great time to set that up. With this issue, we can change, if your plans change or your desires change, we can change this at any time.
Any time is a good time that you're with family to discuss this. At family get-togethers and gatherings, you can sit down with them and let them know what your wishes would be for the end of your life, so that the last moments and days spent with you are not filled with guilt, and they can enjoy the time that they have left with you.
I think it's important to think about it sooner rather than later. It's good to get those things down on paper, your wishes, when you're young, in order to take that burden off of your family, rather than during a crisis situation where things have to be determined very quickly, and it may not be exactly what our wishes are. We do have several resources for people to learn about advanced care planning even prior to coming into the office to have this visit. We are working with Wiser Care. It's one of our computer software programs where we could send you a link to the home, and you get on the computer and actually begin the process from home, which may be a good way to bring your family into it, have them involved, answer some of the questions. When you come to the doctor's office, then we can review all of that, answer any of your questions that you might have, and then get those papers printed and established and put in your medical record.
Your insurance will, if you do it as part of an annual wellness visit, your insurance, Medicare, will cover the part of the planning. Sometimes if you come in and you need more time to discuss it with your family, if you come in, there might be a copay involved for the advanced care planning. You should have a discussion with your family members. But also part of this annual care planning visit is we can put down your wishes on paper, and we encourage you then to go and share these wishes with your family, so they not only have it in writing, but you've also had the discussions with them.
Advanced care planning can be done during a typical office visit. It generally takes a little bit more time, so we appreciate the heads up beforehand. The best time to do it, especially if you're of Medicare age, is during an annual wellness visit. Our RNs are specially trained during this annual wellness visit to go through a process of advanced care planning, and they do an excellent job with it. And then I would come in after that, or your primary care provider would come in after that and go over your wishes and desires, and then you could take that home to your family and discuss that and make sure that everybody was on the same page.